My name is Ron Schechter. I'm an orthopedic surgeon at NEA Baptist Hospital in Jonesboro, Arkansas. Wanted to speak with you today about a service we're offering here in hip replacement surgery. There's been lots of advances in joint replacement surgery over the years, and we've made great strides in hip replacement surgery, and I wanted to share some of that with you today to know what's available. Hip replacement surgery has been very successful for many years. But there's been a great evolution to try and get patients over the surgery easier and faster. In the past, hip replacement surgery started with what was called a posterior approach, where we went in from the side of the hip and then went around the back of the hip to do the hip replacement. This had very good results. It was initially done to make it the easiest on the surgeon to get in and out of the hip and do the technical work. The problem we realized as this evolved was that we had to cut through muscles to get in, and patients had more pain and it was more difficult for them to recover. So over the years we've tried to improve techniques to get in and out of the hip so that we are less invasive and patients don't hurt as much and recover faster. The next trend in the evolution of hip replacements was what was called a direct anterior hip replacement, which meant that the surgeon went in from the front of the hip. It was a very nice procedure in terms of not having to cut through muscles, and patients hurt less and rehabbed faster, but it was not very easy for the surgeon to get into the hip joint. It was technically challenging, and on larger patients it was more difficult. Because of this, there's a higher risk of complications with that approach, including breaking the thigh bone or other tissue damage. So we've continued to look for other solutions, and more recently a technique was developed called a super path hip replacement. With this technique, we actually go straight down to the top of the hip, and we don't have to cut through any muscles. There's been special equipment that has been devised to let us get in and out and do this surgery through small incisions and be minimally invasive. So we've had the benefits of being a smaller incision, less invasive, hurting less, rehabilitating faster, and through this approach we don't have the same risks of complications, including fracture or dislocation of the hip. So it's been the best of both worlds. Right now I am doing this hip replacement super path approach at NEA Baptist. I'm the only orthopedic surgeon in this area doing the procedure. The closest neighboring surgeons doing this are in St. Louis. So for the Arkansas and Tennessee area, we're the only people here that are providing this care, and we're available for your needs if you'd like to get this done. If you're interested in learning more about this, you can look at the SuperPath hip replacement by Mike report on the internet.